Welcome to Health and Wellness. I'm Dr. Jennifer Ashton. Every parent knows how frightening it is when your child is sick or injured. Today, we'll assess how to tell whether that fever is just a fever or that bump is just a bump, or whether it's more serious.
So I have a 19-month-old son, and when he gets sick, he gets really high fevers. And so when is it high enough to take him into the emergency room?
Some rules that might be helpful. If the baby is young, less than 2 months of age, regardless of the height of the fever, a parent should call their pediatrician and they can decide together whether the child should be seen by them or go to the emergency department. For older children, if your child's temperature is greater than 103, that's probably a good time to call your pediatrician and see what's going on. Obviously, no matter what your baby's temperature is, if they're acting sick, then you want to call your pediatrician.
I have a 3-year-old daughter, and I wanted to know about poison control.
The most important thing for parents to know is that there is a national system of poison control, and you just have to call your poison control number. It has been remarkable how effective the Poison Control Center has been in allowing parents not to bring children to emergency departments when it's not necessary.
I have a nephew who's 18 months old. How do I know when his fall is serious enough to take him to the ER?
So children fall, and they often hit their head. First of all, if they're falling from any significant height. Significant height is when the height is equal to or greater than the child's height. You have to worry that they could have had a serious head injury. If there's any question about whether a fall was serious or not, you should bring your child to an emergency department for us to evaluate that child. If the fall results in a large bump on the head or a cut, we should probably see that child.
My question is how to keep a child safe around a big old dog.
As a general rule, approach dogs carefully, ask the owner, never allow the dog and the child to be, for their mouth and face to be near each other, and stay in control of the situation and watch the animal.
I have a 4-year-old son. I want to know when is a good time to bring him to the hospital for a cut.
Anytime that you think a cut is very large or very deep, you should probably come in and have it checked out. If the cut crosses a joint anywhere, that's important for us to evaluate because it's important that it heals correctly, otherwise it can interfere with function. You should always wash it out with soap and water. If the cut occurred in some sand or dirt or on metal, you want to make sure to clean it very well. And then you just want to check with your doctor that your child is up to date with their tetanus shots.
And I'd like to thank Dr. George Foltin for his insights today, and thank you for watching another episode of Health and Wellness. I'm Dr. Jennifer Ashton. Until next time, wishing you good health.